I know we got to keep with the questions, but this whole idea
Yeah,
of authenticity, which is sort of a philosophical question,
I know.
um, medications helping you be authentically
Hmm.
you. Can you just
Yes,
say a
your
word
most
about
authentic
that?
self.
Yeah, just if you could talk a little bit about that, because you have the lived experience.
Hmm.
And I just think it's a fascinating concept that you can be more yourself with something that you weren't born with, like a medication.
Yes.
I just
Um,
want to put this up for you
because
though.
we also, it's interesting because I would maybe do a thought experiment there and be like, would you be like, oh, you're not born with insulin, but when you take the insulin for your diabetes, you're more yourself. Isn't that weird?
Mm,
And it is
great
true.
analogy. Yeah.
Okay, but it's complex. And this is a great topic because when we take insulin for diabetes, it does not make us wonder who we really are. It doesn't make us feel weak. It doesn't make us embarrassed to tell our neighbor. It doesn't, so many things are very, very different when it comes to psychiatric medication because psychiatric medication, we are fearing losing our identity. We fear being controlled by something. We fear being harmed by something. We're like, what is us and what is the medicine? These are valid questions. And so I encourage people to think about medicine as a resource that, when used effectively, is helping you live your most functional, most fulfilled, and most authentic life, not weighed down or held back by a depression or an anxiety or an ADHD. As opposed to somehow there's this like magical self without any medicine that's like the real self. You know what I mean? I think that is a bit of a uh, um, fallacy.